Hey, what's going on, everybody? It's Dr. Matt from Pinnacle Chiropractic, your local pediatric, prenatal, and family chiropractic office here in the Lakewood Ranch, Sarasota, Bradenton, Florida area. And in today's video, we're going to talk about how we're very different than your traditional chiropractic office. So, if you've been following us at all on our social media channels, or seen our stories on Instagram, or visited our website, or even stepped inside our office, then you know that we see a lot of kids in our office. So in this video, I want to share with you what exactly makes our office pediatric focused, because it's not just our toy room or our lollipops that we give out after getting adjusted and the fun that we have. So these five must-haves focus on what makes us different from a traditional chiropractic office and allows us to get amazing results with even the toughest pediatric cases. So we know you have friends and family who may live further away that you have recommended trying pediatric chiropractic. This will help you, and they know exactly what to look for when choosing an office. So this will help both you and your family friends know what to look for when choosing the right office or a pediatric focused office. And not to get ahead of myself, but if you need to help finding an office like ours in another state, we can help. You can check out the PX Docs directory at pxdocs.com. It has over 500 plus pediatric and family offices just like ours around the world for them to connect with. But first, let's share the five must have things to look for in a pediatric chiropractor so you know without a doubt that you're in the right place. So, this is really specifically for you moms out there that want to have that certainty that this is the right place for your child and your family. Maybe you've tried chiropractic before or have a different idea of what chiropractic is due to past life experiences. So, the five things are really the following. So the first thing is really have advanced training in pediatric education. So you want to make sure you're choosing an office that has advanced pediatric education and training. Well, we all know that no matter the industry, education is not everything in and of itself, but taking care of kids and especially tough neurological and chronic illness cases absolutely requires additional and advanced training for a pediatric chiropractor that goes way beyond taking care of the spine, back pain, sports injuries, and the things in standard chiropractic educations. In order to really achieve clinical proficiency, a pediatric chiropractor should have at least an additional 80 to 100 hours of advanced training, be actively involved in ongoing advanced training still today, and is the sort of doctor who constantly is looking to learn, improve, and find ways to get even better clinical results at all times. And this is exactly what our team of doctors invest in each and every month on a consistent basis. We train in a network with hundreds of other pediatric chiropractors through PX Docs and through the ICPA. The most advanced and focused training available in the profession right now for pediatric and family care. The second thing you need to look for is the office has to have a high level of clinical experience. So, first off, this does not mean that a child's pediatric chiropractor needs to have been in practice for a certain number of years or is a certain age. Honestly, some of the top pediatric and family chiropractors in practice today are very young because this new specialty within chiropractic is newer. A lot of the younger generation, like us, are the ones that are choosing to focus on all of our advanced training and clinical experiences in high level pediatric programs and offices. So many chiropractors awesomely have a really big heart for taking care of kids and may even have put the word family in the name of their practice, but day to day see very few kids and still end up with 80 to 90% of their patients being adults with neck pain, back pain, and spinal problems, which chiropractic is very wonderful for helping adults take care of those things, but it does not mean then that they're likely have enough reps to really take care of kids at the most advanced levels as a pediatric chiropractor. This is just like taking your child to a pediatrician versus a general doctor. It's the similar kind of analogy or comparison. The third thing to look for in a doctor's office, a pediatric chiropractic office, is really do they incorporate advanced neurological exams using the insight scanning technology? So, is your pediatric chiropractor using our Insight scanning technology are still relying solely on simple and standard exams like posture and palpation alone. I cannot sing the praises of this advanced technology enough. Personally, I don't feel we should even be providing chiropractic care for simple cases like low back pain without first measuring the patient's central and autonomic nervous system function with the amazing technology, which is our thermal, our EMG, and HRV scans that we do in our office. Looking to make functional and long lasting changes to the neurological function means two things. First, you have to get a baseline measurement to really know what you're dealing with and put together a customized and personalized neurological care plan and adjusting approach for that specific patient. And second, you need to then utilize this technology to continually track and measure progress. When we ask parents who previously saw other family chiropractors and didn't see the results they wanted, if there were any continued progress evaluations, exam scans, or ways to measure if any real change or improvements were happening, the answer is always no, there was not. And so, one thing to really watch out for is if your child's adjustments are just pretty much exactly the same thing every single time on repeat. If a pediatric chiropractor does not utilize scanning technology or a tonal approach to adjusting, this is almost always the case that most chiropractors don't utilize that equipment or a very personalized approach to their adjustments as well. So the fourth thing to look for is, does your pediatric chiropractor utilize a multitude of adjusting techniques, especially neurotonal approaches? So this is getting super nerdy and granular with how chiropractic really works and gets the best results. And yet we can keep it really simple by saying what should be quite obvious. Every single case is different. So each child has their own unique case history with different forms of birth trauma, toxins, illness, emotional stress that negatively affect their nervous system. So if a pediatric chiropractor does not consider all of these different factors and then personalize and match the adjusting technique and approach they use to that child's specific needs, they should not expect to get positive clinical results in many of those complex cases. Our doctor team is trained and experienced in numerous chiropractic techniques and adjusting approaches, and we don't just choose our favorite of what we like to do. We always choose with just one single rule in mind: what is needed for the child to get the best clinical results or outcome. This one actually goes back to number one and number two, where if you don't have the right training and education on a multitude of techniques and the experience in the clinical system to know which one to use when, you're just not going to get the same level of results as somebody that does. And then the fifth really thing to look for is, does your pediatric chiropractor recommend a customized care plan starting out with enough frequency and then recommending enough duration of care? This is one of those things where something so simple can have a profound impact. If the care plan, which is how often a child is adjusted each week and for how long, isn't enough, then put simply, there can be no expectation that a pediatric chiropractor can achieve solid clinical results. The care plan frequency and duration are so pivotal and important that we follow an advanced scientific approach to care planning and utilize it with every one of our patients. If a general family chiropractor does not have an advanced and updated care planning system and the recommendations for your child were just 1 to 2 times a week, or worse, maybe 1 to 2 times per month, then there was no chance that they'd be able to get real neurological change and results given our understanding of how stressed and subluxated kids are today. So if chiropractic hasn't worked for you in the past, maybe as simple as needing a customized data and experience driven care plan that follows the principles that we've talked about in this video. So if this video really resonated with you and you've been looking for a pediatric chiropractor in your area and we're in your area, we ask you to give our office a call, 941-822-8828. We'd love to find out if we can help you and your child or your family members. And the other thing, if you're not around our area, visit pxdocs.com to find a provider in your area that is trained and has these 5 things in their office. Continue to follow our social media channels for more educational content. And really hope you guys enjoyed this video. It's a very important one because you can't just go to a regular chiropractor that maybe sees a handful of kids and expect great changes or great results versus choosing an office that has the clinical expertise, and knows the right amount of care to recommend for these patients is so crucial to getting the results that your child deserves. So as always, guys, I'm Dr. Matt, and we will see you guys on the next video.